Good morning. Welcome to the Senate Budgets Committee Oversight Hearing of the Congressional Budget Office. I'm proud to say that a 30-year drought, this is the third such installment of this committee's continued oversight of CBO under my chairmanship. I'm glad to see that the House Budget Committee will follow our lead with additional oversight hearings later this month. Section 102A of the Congressional Budget Act of 1974 provides the Budget Committee with the authority to review continuing basis the conduct by the Congressional Budget Office of its functions and duties. These oversight hearings present the committee with an opportunity to review CBO's performance and serve as a forum for discussing ways in which CBO can be more effective and attentive to the needs of Congress. Congressional oversight of an office like CBO should also work at clarifying the office's mission while improving its operations. Alice Revlin, the first director of CBO, instructed staff in a 1976 memo when she said, quote, "Our work and our publications must always be balanced, thorough, and free of any partisan tinge." More than 40 years later, Congress, other policymakers, and the public still depend on CBO to provide objective, accurate, transparent, and timely budgetary and economic analysis. Now, one of the difficulties with the office, of course, is that they have to forecast, and that's especially difficult when it's about the future. We do want to have the best possible answers. Of course, we always want them phrased in our own way. I've been exploring the request for more transparency, for getting to see the models. I think that we're mostly asking for the main assumptions used to reach your conclusions. If the assumptions are good and pretty comprehensive, I think we'll have more confidence in the results. This will be the first of many hearings this year. In 2016, we held 13 hearings to find a better way to budget. The ones I could do without legislation are done. The main one was to give the budget to the minority 5 days before the budget markup, with amendments then to be submitted early, and so that side-by-sides could be developed, and better yet, ones that came from both sides of the aisle with similar amendments could get together for even better solutions. I still have a lot of hope for that, and anticipate doing that again. Now, last year was a busy time for the Senate Budget Committee. We approved 2 budget resolutions and facilitated consideration of 2 budget reconciliation bills, one related to health care and one that resulted in the tax reform legislation. This legislative activity, in addition to all the other proposals considered by our authorizing and appropriations committees, put intense demands on CBO. In 2017, CBO produced more than 700 formal cost estimates, several thousand informal cost estimates, nearly 130 appropriation scorekeeping tabulations, and 86 analytical reports and working papers. That's a lot of work for an agency that's about 1/10 the size of the Government Accountability Office. While I am appreciative of all of CBO's hard work, I also believe we must take the time to review these efforts. We need to look back at what went right, but also what may have gone wrong. It's crucial that CBO keep its mission firmly in mind. The Budget Act clearly lays out that mission in Section 202, where we can read, "It shall be the primary duty and function of the office to provide to the committees on the budget of both houses information which will assist such committees in the discharge of all matters within their jurisdiction." This important section refers to CBO's role in assisting and supporting the committees and members in the execution of their duties. And it's always helpful to remember that CBO exists for this purpose. Testifying before us today is CBO Director Keith Hall. Dr. Hall oversees all 8 CBO divisions, which are tasked with producing statutorily required budget and economic forecasts, thousands of cost estimates of proposed legislation, and special reports as requested by Congress. CBO's budget analysis is an integral part of the legislative process. Dr. Hall, when you last appeared before this committee in September 2016 to discuss CBO's operations, you gave us an update on the agency's progress toward several important goals. In addition to reviewing CBO's work in support of recent legislative initiatives, we also remained interested in those goals to increase the transparency of agency analysis and operations and your agency's responsiveness to congressional needs. I'm specifically interested in learning how CBO's views regarding modeling transparency and ways the agency can more clearly communicate the methods, assumptions, and data that underlie budget analysis. Dr. Hall, I also welcome your thoughts on how CBO can more efficiently allocate existing resources, including staff responsibilities, to satisfy these congressional requests and expectations. In 2018 and beyond, CBO will continue to play a key role in supporting Congress as we consider the budget and economic effects of proposed legislation. Its objectivity, accuracy, transparency, and timeliness is essential to help Congress make informed decisions. Just as CBO's role in the federal budget process is crucial, so too is this committee's statutory responsibility to oversee CBO. I'd like to thank Dr. Hall for joining us today, and I look forward to our discussion. Senator Sanders.
Thank you, Mr. Chairman, and Dr. Hall, thanks for being here. I think before we do oversight over the CBO, it might be a good idea to do oversight over this committee. It might be a good idea for the Budget Committee to actually produce a budget. I know that's kind of a radical idea, but maybe that's what we want to do. And maybe it might be a good idea for the Republican leadership 116 days into the fiscal year to actually do something more than giving us short-term budget resolutions. The truth is, as any business person in America will tell you, you can't run any kind of entity on a month-to-month basis. We are a $4 trillion entity. That is what the United States government is. There are some agencies, clearly, that need more funding. There are some agencies that need less funding. And the idea that we're saying that every agency of government every month is going to get exactly the same amount of money as they previously got because of a continuing resolution is insane. And I suspect if anyone looked at it, you would find that we're wasting tens and tens and tens of billions of dollars funding agencies that perhaps don't need that money, or funding agencies that are clearly inefficient. So we're not addressing that, and we keep kicking the can down the road. That is the most important thing that we've got to do, and that's not Dr. Hall's responsibility. He's doing his job. His people are doing their job. It is our responsibility. So, Mr. Chairman, it seems to me that we have got to address, maybe this committee can play a more active role in pushing our colleagues forward on this thing. We have got to address the budget crisis that we have. And let me just address some of the issues, which I think we're all familiar with, that have got to be addressed as we desperately try to come up with a 2018 annual budget. First of all, we have the moral issue of 800,000 young people in this country who were raised in this country, who only know the United States as their home, are on the verge of facing deportation. And let me be very clear about this. If we do not address this issue, I think history will look back at this particular moment and see an incredible moral stain about doing this to these young people. What we have also got to do is create a budget which provides parity. Now, I know there is a great desire to see more money for defense, and we could argue about that. But at the bottom line is, for every dollar that we spend on defense, we have got to spend on the needs of working families. 5 minutes ago, I just came from my office where I talked to parents and administrators in the Head Start program in Vermont. And they are telling me, as I'm sure that they are telling you in your offices, that children all over this country, little kids, 3, 4 years of age, are being impacted by the opioid crisis. Kids are being taken out of their homes because their parents are addicted to opioids, going into foster homes. We got a crisis. We're not dealing with that crisis. Unbelievably, Mr. Chairman, we have 27 million people in this country who utilize community health centers to get the health care, the dental care, the low-cost prescription drugs, the mental health counseling that they need. 27 million people, 1 out of 4 people in my own state. We have not reauthorized the community health center program. We got 30,000 vacancies at the Veterans Administration. So instead of giving speeches about how much we love veterans, why don't we make sure that the VA is adequately funded and adequately staffed? Some of you may have seen a piece in the Washington Post last month. Unbelievable. 10,000 people with disabilities died last year while they were submitting claims to the Social Security Administration, who does not have the staff or the funding to process those claims. 10,000 Americans with disabilities died. Are we going to adequately fund the Social Security Administration? Or are we going to pass another continuing resolution leaving them grossly underfunded? In parts of my state and in parts of your state, Mr. Chairman, I am sure there are communities that do not have adequate broadband. How do you bring businesses into those communities? How do kids do their homework if there is not adequate broadband? In other words, there are enormous needs facing the American people. And those needs are not just giving huge tax breaks to billionaires or trying to throw 30 million people off of health care. There are needs that we have got to address. So, Mr. Chairman, I would hope that we have a serious debate about the budget of the United States of America, and we do it as soon as we can. Dr. Hall, thanks again for being with us.
Thank you, Senator Sanders. Appreciate your remarks, and I've made a number of notations here. We will have more hearings during this year, and I think that I'd be interested in what different members of the committee would be interested in, particularly pursuing in some depth as kind of a task force for oversight for us so that we can do a better job of budgeting. Our witness this morning is Dr. Keith Hall, the 9th Director of the Congressional Budget Office. Director Hall is no stranger to this committee, having served as CBO Director since April of 2015. Since that time, he has appeared before this committee to discuss the CBO's work and its projections for the nation's fiscal situation. He has more than 25 years of public service with the International Trade Commission, with George Mason University, with Bureau of Labor Statistics, with the White House Council of Economic Advisors, with the Department of Commerce, and an international economist for the ITC. He's also an assistant professor at the University of Arkansas and an international economist at the Department of Treasury. In those positions, he worked with a wide variety of topics, including labor market analysis and policy, economic conditions and measurement, macroeconomic analysis and forecasting, international economics and policy, and computational partial equilibrium modeling, which I hope he won't explain this morning. He has a PhD and a master's in economics from Purdue University. This morning, Dr. Hall will be talking with us about CBO's work over the last year and the goals he set out for this critically important agency. We look forward to receiving your testimony. For the information of colleagues, Director Hall will take up 7 minutes for his opening statement, followed by questions. Welcome, Dr. Hall. Please begin.
Chairman Enzi, Ranking Member Sanders, and members of the committee, thank you for inviting me here to discuss the work of the Congressional Budget Office. As you know, CBO's mission is providing nonpartisan budgetary and economic analysis to support the work of this committee and the Congress as a whole. My colleagues and I are devoted to that mission, and I appreciate the opportunity to discuss how CBO has executed it this year and how we plan to expand our work in the future. I also want to take this opportunity to thank you for your support and guidance. We at CBO have long relied on the budget committees to explain to others in the Congress what our role is, to provide constructive feedback on how we can best serve Congress, and to provide guidance on what legislative developments are occurring and what the Congress's priorities are. That work on your part has been key to our success over the years. In the past year, we have provided Congress with 740 formal cost estimates and mandate statements. We've also provided thousands of hours of technical assistance to committees, which have included thousands of informal cost estimates, probably more work than our formal cost estimates. We've provided 128 scorekeeping tabulations, 86 analytical reports and working papers, dozens of files of data underlying budget and economic projections, and numerous other publications. Many of the cost estimates were produced under very tight time constraints and required extraordinary efforts by our staff to meet legislative deadlines. We also undertook new initiatives to enhance our responsiveness and transparency. We reorganized work processes and shifted resources to areas of high demand. We published more evaluations of our projections about the economy, spending, and health insurance subsidies. We documented more of our analytical methods about flood insurance, pension benefit guarantees, and health care for the military, for example. And we gave more examples of changes in our estimates addressing issues ranging from Social Security to options for changing Medicare. In the next 2 years, CBO plans to continue to support the budget committees and the Congress by producing budget and economic baseline projections, reports about those projections, and cost estimates for many proposals, including all legislation reported by committees. Other major products will include a volume of policy options that would reduce budget deficits, reports on the long-term budget outlook, analysis of the President's budget proposals, monthly budget reviews, and policy analyses on a broad range of topics of interest to congressional committees. CBO is reviewing and updating every aspect of its simulation model of health insurance coverage, which forms the backbone of its budget projections related to federal health care spending for people younger than 65. In addition, CBO will further develop its capabilities to assess the macroeconomic effects of fiscal policies and the ways that changes in federal regulations affect the agency's baseline projections. Responsiveness and transparency are top priorities of mine, and we have plans to bolster them further. We will make greater use of team approaches to handle surges in demand for analysis of particular issues. We will increase public documentation of our computer models. We will also do more to explain how analysts employed those tools as part of the process for producing estimates. I like to think of this as documenting our processes as well as our models. For a cost estimate, for example, an analyst identifies the ways in which a proposal might affect the budget and assesses which of them would probably have substantial effects. The analyst also consults experts and examines the most relevant data and research to form a basis for the estimate, which includes determining which models to use, if any, what information to put into these models, and how to use their output in combination with other available information. In short, CBO models do not produce estimates, CBO does. The models are just a few of the tools that we use in producing our estimates. We'll be able to make significant progress on our plans to boost responsiveness and transparency if we receive funding for fiscal year 2018 within the range that the Senate and House Appropriations Committees have recommended. If we receive the funding available under the continuing resolution currently in effect this year, we will make less progress. Moreover, CB's ability to buy data and research and to pay for other standard activities would be severely limited under the funding specified in the continuing resolution, and the agency's performance of its mission would be degraded. Many initiatives of great interest to Congress could be undertaken only if CBO had more employees, so we have submitted a budget request to hire 8 new staff members in 2019 to bolster our responsiveness and transparency as part of a plan to hire a total of 20 additional people by 2021. The new staff would help CBO respond to requests for information more quickly when there's a surge in demand. They would also allow CBO to supply more information about its analysis and models without reducing the valuable services it provides to Congress and its current staffing level. In the next 2 years, CBO also proposes to expand analytical capability by adding new healthcare analysts and creating additional on-site capacity to use sensitive data securely. I'm delighted to talk with you about our work today and would be at any time in the future as well. I'm happy to meet with members of Congress or to chat on the phone. In addition, our employees meet frequently with the congressional staff to explain our analysis and to answer questions individually and in groups. And we have plans to be in still better contact. For instance, earlier this month, in collaboration with the Congressional Research Service, my colleagues gave presentations to 150 congressional staff members about how CBO develops estimates of health insurance costs and coverage. We're constantly looking for ways to serve your needs better, and I welcome your suggestions.
Thank you, Director Hall. Now we'll turn to questions. Let me take a moment to explain the process. Each member will have 5 minutes for questions, beginning with myself and then Senator Sanders. Following the two of us, we will alternate questions between the Republicans and the minority. All members who were in attendance when the hearing started will be recognized in order of seniority on their side. For those who arrived after the hearing began, you're on the list in order of arrival. If it's your turn to be on the list to be recognized, but you aren't available, you move to the bottom of the list, and I turn to the next senator to ask questions. With that, I have a few questions. A recent legislative proposal introduced in the House and Senate would require CBO to publicly disclose its models and data. You mentioned that in your testimony. The intent of this legislation is to increase transparency and allow for outside analysts to reproduce and replicate CBO projections. While you've made significant strides to open up CBO's work to the public, what efforts are currently underway at CBO to increase the transparency further, both to Congress and the public? Do you think that disclosing CBO models and data would improve the legislative process and the public confidence in the final products? And how would that vary from sharing more assumptions that are used?
Well, thank you. Well, we are committed to transparency, and we've certainly been trying to increase transparency. One of the things that we've tried to do is we've tried to do this intelligently, treat our decisions on transparency as good business decisions for us. There are lots of ways of being transparent. Different ways of being transparent have different benefits to Congress and have different costs. With respect to benefits, who we direct the transparency to, are we being more transparent to members or staff? Are we being more transparent to outside experts who can evaluate what we're doing? And then, of course, cost. There can be significant time and resources used to become more transparent. So we have to make this sort of benefit-cost trade-off analysis when we do this. And part of what we're doing, for example, is we have some ideas on being more transparent. We're calling them pilots in a sense because we want to try them and sort of see how that's received by Congress. See if that's the sort of transparency that you're most interested in. One of the things that we're doing, for example, is we're doing a complete rewrite of our main model for doing healthcare insurance estimates, the so-called HISIN model. That rewrite will happen over the next year, but to give you an idea, we had plans to, since I've been on board, we had plans to completely redo this model. And so it's been 3 years. We would have been finished by now if over the past year we hadn't gotten so many healthcare related requests. So the same people who would be updating the model were busy doing cost estimates.
That fits in with my next question, because one complaint that I often hear from colleagues is that they're unable to receive estimates on their legislation in a timely manner, but CBO has plenty of time to release a number of other products and reports. How would you respond to that complaint? Are these reports the result of congressional requests, or are they agency initiated? Can CBO provide a list of published reports that did not originate due to a specific congressional request or not directly attributed to a single requesting office?
Well, yeah, well, thank you for asking that. As I recall, when I first came on board, you expressed concern about that. We have not started a single analytical report since I've been a director without having specific congressional interest from a congressional committee, expressed interest from a committee with jurisdiction. So we simply do not do analytical reports just on our own. We square that away first. And second, of course, is we have lots of different areas of expertise. So when we're really busy in healthcare, we only have so many people we can pull into healthcare. So we have time for other people to work on other reports. We do our best to not let our analytical reports at all interfere with our work on cost estimates, for example, our work on developing models for cost estimates and that sort of thing.
How do you prioritize those requests for reports, though?
Well, we look to committees. We try not to prioritize things ourselves. We get way more. We try not to prioritize things ourselves. We get way more work than we could possibly handle. So what we do is we look to committees of jurisdiction and ask them what are their priorities, and we follow their priorities. One of the more frustrating things that I have to do is I get calls from members sometimes who have a piece of legislation they'd like CBO to look at, and if we're really busy with committee work, we have to ask a committee, can we make this a priority? And quite often the answer is no. Our work takes priority, so we have to put off work. And I know that's frustrating, but again, we're trying to take direction from committees as to how to direct our resources.
We'll be looking into whether there's a role for the ranking member and the chairman of the Budget Committee to have more of a role in that ranking. And my time has expired almost, so I'll turn it over with Senator Sanders.
Thank you, Mr. Chairman. Dr. Hall, as we contemplate maybe someday passing a budget here, could you help me refresh my memory here? But my recollection is that in the Budget Control Act of 2011, one of the cornerstones of that bill was parity, equal funding for defense and non-defense. And if I am correct, the next 3 budgets that were passed also had parity as a cornerstone. Is that correct?
That sounds right, yes.
Dr. Hall, my Republican colleagues have spent a lot of time this year on health care. And if my recollection is correct, your agency has been criticized a bit for the analyses that they provided us on various health care proposals. So let's go over it again, because I think the consensus is that you were right in your analyses. But bottom line is that on January 17th, 2017, CBO scored the so-called Restoring Americans Healthcare Freedom Reconciliation Act. Mr. Chairman, we've got to do something about these titles. There should be a truth in advertising, too, but which was vetoed by President Obama. CBO found that 32 million fewer people would have health insurance after 10 years, and that average premiums in the non-group market would almost double by 2026. Does that sound correct?
That's correct. The only thing I would say, that is also relative to a baseline, so an expected change in coverage and that sort of.
Right.
Yes.
On May 24th, CBO scored the American Health Care Act as passed by the House. CBO found that 23 million fewer people would have health insurance after 10 years. Does that sound about right?
Yes, it does.
Okay. So in other words, what CBO did is made the obvious conclusion that when you substantially cut federal funding on health care, lo and behold, people lose their health insurance. And I won't ask you to comment on this, but I think you came up with the obvious conclusion. But because you came up with that conclusion, which was not terribly palatable to some of my colleagues, you were criticized, and I think that's unfortunate. And I think we should let these guys do their jobs and come up with their objective conclusions without attacking them because we don't like the conclusions that they have. Let me go to another area. After trying to throw tens of millions of people off of health insurance, my Republican colleagues then took a look at taxes in the United States. Am I correct in saying that CBO's analysis said that the legislation that was finally passed would add more than $1.7 trillion to the deficit when interest costs are included? Does that sound about right?
Yeah, although I'd have to give credit to our colleagues in the Joint Committee on Taxation who did the actual hard work.
I know that. But that sounds about right, yes?
Yes.
Am I correct in saying that the JCT's analysis determined the legislation would add more than $1 trillion to the deficit even when we use dynamic scoring? Is that a fair representation?
That's right.
Now, I won't ask you to comment on this, but I will comment that day after day, month after month, I've heard about world collapsing when we add to the deficit and the national debt. That's not your issue. Some of my colleagues apparently forgot about the lectures that they gave us over and over again about deficit spending. Dr. Hall, on November 8th, CBO re-estimated the effects of repealing the Affordable Care Act's so-called individual mandate. CBO estimated that the change would increase the number of uninsured people by 13 million within 10 years and increase premiums by about 10% in any given year. Does that sound consistent with what you told us?
It does.
Okay. More recently, on January 11th, CBO estimated the cost of extending the Children's Health Insurance Program for 10 years. You projected that a 10-year extension would actually save the government $6 billion. Does that sound about right?
Yes, it does.
Okay. All right, let me just conclude by saying, you know, I think under a lot of pressure, your agency is trying to do the objective work that is expected of you, and that I hope that some of my colleagues would refrain from attacking the agency because the results that you produce are not something that they are comfortable with. Thank you, Mr. Chairman.
Senator Johnson.
Thank you, Mr. Chairman. Dr. Hall, I want to go to kind of the line of questioning the chairman was engaged in terms of who decides what you score. I guess who do you report to? And the reason I'm asking questions, after the election, knowing that we're going to be bringing up health care, I started through staff informally requesting scores on what would happen if we would repeal the market reforms. Didn't get very far, so on March 23rd, 2017, I sent a letter to you, signed by the chairman and 20 of my other colleagues, so 22 Republican senators, requesting, pretty simple, we request the Congressional Budget Office, in consultation with Joint Committee on Taxation, estimate the budgetary effects of repealing the Obamacare insurance regulations. Now, you're aware of the reason we need that. Well, first of all, just to understand what policy might cause, but also there's no way that we can even bring it in front of the Senate if we don't have a score to present to the parliamentarians. So this is a basic piece of information we needed. I want to know, why didn't we ever get that score? Again, this is 4 months before this really came to head.
Right.
The only response we got is, I can't do it. Now, you do all kinds of different things. Okay, you make all kinds of estimates. I'm going to talk about next about the estimate of number of people losing insurance. Just simple, why didn't we get an answer? 22 Republican senators asked for this analysis. What would it cost the government if we repeal those market reforms?
Well, I can tell you that our health group was just working flat out for months.
This was in March.
Even in March, we were working flat out in months. One of the things that is underrated, one of the reasons I try to make a point about it, is we do a tremendous amount of what I call technical assistance, where we're getting draft legislation from a committee of jurisdiction, and that's going to ultimately wind up being real legislation.
So again, I will file this in private with you, okay? I want to find out exactly why we didn't get this, okay? I want to move on to the question of insurance coverage. Your scores under Obamacare used the March 2016 baseline, which again, by law, you had to do that. But it's also true that in January 2017, you created another baseline in terms of people, in terms of insurance coverage, correct?
Right.
Now, in your score, and of course, this was the grenade that CBO threw into the health care debate that pretty well poisoned the well. You said that in 2018, 15 million Americans would lose health insurance because of the Senate bill. That's broken down 7 million in the individual market, 4 million Medicaid, 4 million employer. The problem with that is that's comparing against the March baseline. If you compared it to your most recent baseline, January, the individual market, there had been no additional uninsureds. That 7 million would have gone away. We would have been left with 8 million, 4 million dropping Medicaid coverage, 4 million on employer. Now, I can understand without a mandate why people might lose employer coverage. Why would people drop free Medicaid? Now, fast forward in terms of your estimate for 2026, the 15 million grew to 22 million. But again, 7 million of that should just be excluded because you already had updated your estimate that there would be nobody losing coverage on the individual market based on your January 2017 baseline. So that leaves 15 million people. 22 minus 7, 15 million people, all losing Medicaid. Now again, you can say people are going to drop basically free coverage because there's not an individual mandate. It makes no sense whatsoever to me. It makes no sense. So I had a conversation, one of the most frustrating ones I've ever had, with Mark Hadley. Now, in that I asked for the CBO and their latest our replacement piece of legislation to break out Medicaid expansion versus Medicaid, and you did that, and I appreciate that. And I think that's very helpful. It certainly helped my analysis of it. But I also asked a very simple thing. So, fine, compare your coverage estimates with your March 2016 baseline, but because you also have a new baseline, why don't you just put that as an alternate scenario? Now, the response I got, well, it would take 2 weeks. You've got the baseline right here showing 19 million people uninsured on the individual, 19 million under the Senate bill. 19 minus 19 is 0. I mean, I could do that in seconds. Why did you refuse to provide the American people the information that wouldn't have been freaking them out, where we could have really looked at this analysis and go, oh, well, okay, 8 million people losing, 4 on the individual or on the employer market, 4 Medicaid. Really, we're probably looking at 4. Why didn't you provide that alternate scenario?
Well, first of all, it's not clear that the alternate scenario would have gotten the different numbers that you suggest. Let me just put it that way. Because they were changing the baseline had sort of 2 effects, right? Because the premiums were higher, while at the same time the coverage was lower. Also, when we talk about the 15, let's go back to the 15 million drop in Medicaid. That's really, most of that is not a decline in Medicaid, but that's the legislation ended the expansion of Medicaid. So those were people who primarily who don't have Medicaid and who won't get it over the next 10 years who would have under current law at the time. So we're not really talking about people dropping from Medicaid, but people from not.
Again, this is just a simple math. You come up with an estimate, you compare it against a baseline, and you're not providing people, the American people, with the information they need. Thank you, Mr. Chairman.
Thank you, and there will be an opportunity at the end to submit additional questions, too, that we might want to have answered. So next would be Senator Van Hollen.
Thank you, Mr. Chairman. Dr. Hall, welcome. And Senator Sanders covered some of the issues I was going to ask you about, but I want to ask you about the impact of CRs, continuing CRs, on the work of the Congressional Budget Office. We heard from the Pentagon spokesperson a few weeks ago that going from CR to CR, we've now had 4 results in wasteful spending at the Defense Department and has negative consequences for our defense. Does going from CR to CR make your work at CBO harder, and what are the consequences of it?
Well, it does make things harder. We've actually put off some things that we're continuing to put off, some computer work and some things like that. If we continue under a CR right now, I think we'll have to curtail our hiring. We'll have to move down a few slots. We'll probably have to cancel some training and travel and that sort of thing. So it does have a consequence for us. It does sort of degrade our. In
terms of your planning, does it make your planning harder, and does that lead to some inefficiencies in terms of your ability to hire when you need to hire?
Yes, it does.
Okay. Let me ask you about the CHIPS program and the scoring, because the good news is the Congress reauthorized the Children's Health Insurance Program for 6 years, and as was referenced, the Congressional Budget Office estimated that would actually save money. I think you said $6 billion compared to the earlier baseline. Is that right?
Yes.
Okay. And your analysis of savings was not as a result of the cost of providing health care services to these children going down, was it?
No, it wasn't.
Right. It was the cost of the alternative going up, right?
That's right.
And the alternative is the health care provided in the Affordable Care Act exchanges primarily. Is that right?
Yes.
Okay. And the primary reason those costs went up was as a result of the fact that the elimination of the individual mandate resulted, according to CBO, in the cost of premiums going up by 10%. Is that right?
Yes.
All right. So I think this is an important point for people to understand that the reason the cost of providing services to CHIP went down is because those children, if they were denied that alternative through the Children's Health Insurance Program, would have gone into the Affordable Care Act exchanges, and as a result of the individual mandate removal being the primary cause, the cost to the taxpayer would go up, because when those premiums go up, we all pay a higher tax credit to help meet the needs of those individuals. Is that right?
That's correct.
So that really is my, it just shows that when you do one thing to pull the rug out of the Affordable Care Act, when you get rid of the individual mandate, you increase the premiums by 10%. And so that meant that if you didn't extend the Children's Health Insurance Program, those kids coming into the Affordable Care Act exchanges would have been paying higher premiums. As a result, the tax credits that we provide people to make sure that that health care in the exchanges is affordable would have gone up. So, yes, it's great we extended the Children's Health Insurance Program, and we saved $6 billion, but the savings was relative to the baseline, and the baseline costs went up primarily because of the move in the tax bill to get rid of the individual mandate. I just hope members will understand the consequences of their action with respect to actually saving taxpayers money and providing an important benefit to our kids' health. And I really do appreciate the Congressional Budget Office because sometimes, some of us agree with your analysis, sometimes we disagree with the analysis. But my goodness, if we didn't have some kind of referee here in the United States Congress, we would have even more of a free-for-all than we already have, and we already have a hell of a free-for-all. So I'm grateful for somebody being able to take an objective look at this and provide an analysis that we can use. There are too many, we're already having a dispute nationally over what's fact and what's fiction. I'm grateful that you provide us some baseline for what is fact, at least as regards to the budget. Thank you, Mr. Chair.
Thank you, Mr. Chairman. Thank you, Dr. Hart, Dr. Hall, for being here again. I want to talk about partisanship just a minute. I found three things this morning in a bipartisan way that I agree with the ranking member today, and I want to put that in the record. Number one, I agree with his first opening comment about we need to be serious about the budget process and recognize that it's broken. The second thing is we all want to find a way to solve the DACA issue. And the third, maybe most important, we need to find a way to simplify our titles of bills around here. But I also want to agree with my colleague, Senator Van Hollen. Thank you that you are attempting to be an objective source for information for modeling and anticipation and projecting the impact of potential legislation. But I want to talk about how to achieve that. First of all, this is the most partisan, one of the most partisan committees that I have seen. I was on Judiciary as well. It's very partisan as well. But this is a very partisan committee, and unnecessarily so. But it is partisan because of the budget process. Members of the other side of the committee, several members there, Senator Whitehouse, Senator Kane, members of this side, I think we all agree the process is broken, and it creates a situation here because the budget is not a law, it's a resolution. Therefore, the majority crams down the throat of the minority their political statement about what they think that they should do in spending. You get caught in the middle. One side likes your opinion, the other side doesn't like your opinion. This will change at some point in the future. They'll be in the majority, we'll be in the minority. Nobody's going to like it. This is a broken process. We have to fix it. But in the meantime, you play an important role, and I think it's absolutely critical that you be as nonpartisan as you can be. And I have two questions for you very quickly. One is, I agree with the chairman and the ranking member that they should be involved in the priorities of what you're allocating time and resources to. You heard very important questions being asked during the health care debate as well as the tax debate that didn't get answered. How do you respond to that? And then I want to talk about how you're assuring that that we maintain a nonpartisan position in here. Very quickly, just on hiring. I mean, I'm sorry, on the priorities. Would you address that very quickly? And then I want to go to one more question real quick.
Yeah, one of the difficult things for us is we do so much technical assistance, which often leads to a formal cost estimate. But by technical assistance, we're looking at legislation, we're giving feedback and formal estimates. That is so often done by a committee or leadership, and they want it done confidentially because it is sort of technical assistance. So we wind up doing a lot of work over time where the Budget Committee wouldn't know what we're working on, and we can't tell them that. And so what we've done is we've developed what we think is the most effective thing we can do, and that's when when we're jammed up on topics, we look to the Committee of Jurisdiction to tell them, hey, we've got these things going on. Tell us Tell us what your priorities
But
are.
the ultimate priority really exists in the, or resides in the Budget Committee, right?
Yes.
Among all of those. Okay,
That's
so
right. That's
let me go back to one other thing then. In terms of this partisanship, this is before your time, so I think you can be objective to the response. The question is how to avoid this in the future. It's one thing to disagree with the projection. It's another to look at reality and compare it back to the projections, which is what we do in the real world in business. In 2013, CBO predicted that Obamacare enrollment in the individual market would be, for the years 2015, 16, and 17, would be 13 million people, 24 million people, and 26 million people, respectively. The actual enrollment was 11 million, 12 million, and 10 million. Now, when you see 100% error like that, it raises questions in my mind about impartiality, particularly when the author of those estimates, the head of the CBO's Health Analysis Group, was formerly the head of Hillary Clinton's 1993 Healthcare Task Force. I have to ask the question, how do you ensure, you weren't there then, going forward, how do we assure ourselves that we're getting a nonpartisan, objective viewpoint, to Senator Van Hollen's point earlier?
Well, we do a lot to try to seek guidance and advice from experts on both sides. We try very hard. We actually do our best to go back and look at how we did. We went back and looked at how the estimates turned out there. The only thing I'd say, in defense, of course, is sometimes it's really hard to estimate these things.
Sure.
And I think one of the conclusions I would make in going back is certainly with the exchanges we were off. We weren't as far off on things like the actual spending, some other things. But everybody else was as well. So if everybody, in fact, we were probably more accurate than most others.
Doesn't give me a lot of comfort.
I know it doesn't. But it goes to the issue of bias, right? We can be off and we can be wrong, but we're not, hopefully we're not consistently wrong. I'm a little disturbed that we're consistently overestimated, for example, the exchange participation. We tried to fix it, we still overestimate. Try to fix it. I have a background in economic data. When you're doing economic data, you don't want to have revisions all one way. You want to rise up and down.
Right.
That's what we'd like to have. But we try very hard to do that. We try with the processes and try to do it that way. And try to be transparent. That's why I approve this transparency push.
Thank you. Thank you, Mr. Chairman.
Under White House.
Thank you, Chairman. First, let me echo what my friend Senator Perdue has just said. We have seen the Budget Committee become 100% partisan and 0% meaningful. In fact, the most important work that we do here is not even budget work. It's simply the political task by the majority of opening the procedural gateway to another partisan political effort down the road in the Senate. Short of that, we don't need Dr. Hall, we don't need staff, we don't need anything, because we don't do anything in this committee. There's a reason that over and over again we have committee hearings, even nominally on the budget of the United States, and nobody even bothers to show up in the audience, because people know perfectly well that what we do here has exactly zero effect. Once appropriators got accustomed to beating a 60-vote margin in the Senate on appropriations bills, the Budget Committee's penalty for breaking our budget, which is you have to get 60 votes, made us useless. The fact that we only look at appropriated funds, not the far larger amount of money that goes sloshing out through the back door of the tax code, not the health care expenditures of the country, just contributes to my sense that we have made ourselves a useless committee, and it's something I'm extremely eager to correct on a bipartisan basis. The issue that bedevils us, I think, the most here is the health care cost issue, and Dr. Hall, I think you've seen me do these before. This is one of my least favorite graphs that has life expectancy in years among the leading developed countries and cost per capita in health care. And basically all of our major competitors are here in this kind of bolus of competition. We're way the heck out here. We cost a fortune more per capita than any other industrialized country, and we have life expectancy comparable to Chile and the Czech Republic. So it's not like we're gaining these massive health gains from that massive expenditure. So you guys do some really good work, and this is, to me, one of the more interesting things that I have seen. The red line on the top is the projection for federal health care spending that was made back here. That was in August of 2010. In January of 2017, this experience, the actual green line, then got baked into a new projection. And the new projection for this 10-year period is lower by the amount of this green block than what CBO had previously estimated. That reduction is $3.3 trillion in healthcare savings. If we could pass something in the Senate and in the House that gave us $3.3 trillion in healthcare savings, that would be one of the most significant things that we could do. The problem is, we don't know exactly why that happened. That's a combination of early experience and then algorithms that you guys run to make your projections with that we don't have a lot of transparency into. So to me, if you're looking at the possibility of multiple trillions of dollars in future healthcare savings, it ought to be an absolutely critical priority, a bipartisan priority of this committee and of your office to be trying to figure out and explain what are the things that can help make that happen. What are the things that might even dial it up a little bit? If you can get 3.3 trillion, why not 6.6 trillion? So I hope if we're going to spend more money on staff, this becomes a really important priority, explaining why. Because if you can explain why, we can try to do more of it. Now, I will say that we have accountable care organizations, provider accountable care organizations in Rhode Island. It's basically doctors' offices that have agreed to sign up for placing a bet that they can give better care at lower cost to their patients, and in return, they don't just get paid for doing procedures and prescriptions, they get a bonus from CMS for doing a good job. Some of the best ones in the country are in Rhode Island, and they are seeing their cost per patient actually go down year over year. And they're generating millions of dollars in savings just in their little local practices. So somehow there's a connection between being able to save $3.3 trillion just over 10 years in healthcare expense and these local experiences that we're all seeing in our provider and other ACOs. How to maximize that, to me, I think is a job worth doing in a committee that otherwise appears to have no purpose. So look forward to working with you on that, Dr. Hall.
Let me just say that falls right into our category of analytical reports that we do. And that's exactly the sort of thing that we like to look at, that's really of interest budget-wise, but explains things.
Thank you. And at the beginning of 2016, we said the budget process was broken, and we did 13 hearings and had a number of things that we had hoped that we would pass before the election so we wouldn't know who the president was going to be or who the majority was going to be. But we didn't have enough people involved in that process, so it got stopped before the election.
Don't give up hope, Mr. Chairman.
I won't, and I'm planning on doing some hearings based on some task forces led by individuals on this committee, bipartisan ones, and suspect that you have an intense interest in health care. Senator Cotton. Welcome to the committee as our newest member.
It's good to be here. I'm saddened to hear the senator from Rhode Island and the senator of Georgia agree that it's become very partisan. I suppose I was added to make it more bipartisan. And I want to start with a bipartisan conversation that I think will matter to both sides of our aisle because it's just about the way the CBO interacts with members of this committee and members of Congress as a whole. The way they respond to requests for information from us. I want to use an example, the analysis CBO did last fall about Medicaid coverage losses under one version of our health care bill. I'm not sure which one it was. some of your analysts came to the Republican conference meeting to explain, I think it was a 5 million person loss under Medicaid. And that analysis turns out to have assumed that some number of the 18 non-expansion states would expand Medicaid despite their previous decisions not to since the 2010 law. And then if our bill had passed, those states would then decide to drop Medicaid. When asked which states would be doing that, and especially if Texas and Florida would be doing it, the two largest non-expansion states, since if you didn't have one of those to expand there, you couldn't even get to 5 million in total population. The analysts told us they couldn't answer that. They don't make that kind of prediction. They were just going on past programs and so forth. I found that pretty astonishing. I mean, at root, that's more of a political judgment than it is an economic assessment. And there's just no good explanation for why they reached that conclusion. And I found that to be fairly consistent with my study of CBO reports, which are usually pretty good when it comes to government revenues and outlays, but leave something to be desired when it comes to things like political judgments or market forces and incentives or the incentives of private individuals. And I believe that those assumptions are rarely made adequately public or explained. And it makes it harder for us to do our job and certainly harder for the public to understand the kind of projections you're making. Let me stop there and see if you'd like to respond to that.
Well, sure. We're not particularly happy about having to make that sort of assumption, but it was actually absolutely key to understanding the proposal, that how many states will choose to expand or not expand. If we choose no more would expand, that's an assumption. That would affect our numbers. If we chose that more, some would expand. We're trying to do that. We tried our best to look at past history, and what we did is we put states into buckets. We had different buckets, more likely to expand, less likely in the middle. And we actually really did put the states in there, but our thinking was we didn't want to talk about particular states, because if you're wrong about a state in the wrong bucket here, it should be over here, there might be some state here that should be over there. So the errors can somewhat cancel out.
If I could, Mr. Hall, though, I don't want to get into the details of that particular analysis. My point is, though, that was a very small universe of data, 18 data points. It's not millions of data points as you're often used.
Right.
The kind of analysis and assumptions you just made was not explicit in the reports we received. It took 4 of your analysts coming to explain that to us in detail for senators to understand it and certainly for the American people to understand it. Why not just make that kind of thing public? Do something like, different scenario analysis, making your assumptions more explicit both for us and for the public.
We're happy to start trying to do more of that. My only defense at this point is we only have so many people, so much time, and that these are trade-offs. But if Congress, if you all want more time spent on that sort of transparency, we'll do it.
How many people do you have?
Well, on health care, let me just do health care first. Health care, complete health care, we have 40 people. So the people who are really engaged were probably less than 20 people in all these estimates. So we have 230 people total. We have about 40 on health care. We have lots of other buckets we have to cover. So we're not huge, but we do have some people, and I tell you, they were working full out on things.
Let me conclude with a story. In the summer of 2013, I was a new congressman, and there was an immigration debate going on at the time. The CBO had produced an immigration estimate, and it was controversial, I think, on all quarters for the estimates it made about future immigrant flows, legal versus illegal, impact on population, impact on wages, and so forth. I wanted to get a little more information about that. I spoke with your predecessor after some time. He offered to come by. I said, I don't want to just get the wave tops here. I want to get down into the details. He said that they just don't have the resources to do that. I said, I'll come to you. You don't have to come to my office. I said that it wasn't a finished product. I said, look, 2 years ago, I was modeling, complex economic and business problems at a private consulting firm. I understand how to work a spreadsheet. I'll sit with your analyst at her desk and go through everything, and that was refused to me. Is that an appropriate response to a member of Congress?
No. We would like to do a lot better.
So if I have a similar question about a future analysis, then I would be welcome to come and sit at someone's desk and walk through assumptions and modeling.
Absolutely. I never refuse to go and talk with a member and bring staff and talk about something.
Thank you.
Thank you. Senator Kane isn't here, so Senator Kennedy.
Dr. Hall, thanks for coming today.
Thank you.
CBO has a well-deserved, I think, reputation as being a neutral arbiter. And I understand you work under a lot of pressure. I get that. You and all your people are very, very, very bright. That much is clear to me. You're serving us, but you're also serving the American people. And I'm going to make just a couple of suggestions about what we need, but more importantly, I think the American people need. Number one, you've got to move more quickly. Now, I know that's easy for me to say, but for a variety of reasons, I think the pace is quickened in many respects when we get in the middle of discussing an issue. Number two, you've got to be clearer. It doesn't do any good, and I don't want to overstate this, please. That's why I preface what I'm saying here with how extraordinary I think the work you do. But the analysis has to be thorough, but it's got to be written in non-Swahili so that the American people and the press can pick it up and say, okay, here are the conclusions, here's why CBO reached some conclusions, and here are the assumptions that they're making, understanding that you're not clairvoyant, and in predicting the future, you have to make certain assumptions. Now, you can accompany that with a long, detailed PhD dissertation type document, and I'm not being critical, which I can assure you more members of Congress than get credit for it will read. But what's important, it seems to me, is that we get it quickly and that the American people have an opportunity to understand it better. Now, that's not because the American people are stupid. They're not. I've said this before. Most Americans don't read Aristotle every day. But they figure, because they're too busy earning a living. But they will figure it out. I'm just suggesting that we can all do a better job of helping them do that. You know, that's my only comment. I know it's easy to criticize in Monday morning quarterback, and you work under a lot of pressure. But we got to have it faster. And I think the American people, given your well-deserved reputation, deserve a little more clarity.
Okay.
And I say that gently and with a spirit of gratitude for the good work you do.
Well, thank you. I think you've identified the two biggest problems I think that we have is the responsiveness and the transparency. And unfortunately, they sometimes collide with fixed resources.
I know.
And so we've been working hard to sort of think of some ways we can improve that process-wise. And it's also part of why we're asking for some more resources.
Thank you.
But I appreciate the feedback. Thank you.
I'm not leaving because, I'm away over here. No, I'm not. I've got to go back to another committee, but I want to thank you for being here today.
Well, we appreciate any more ideas you have on how we can do our job better.
Will do. Thank you, sir.
Great. Thank you.
Thank you, Senator Kennedy. Senator Bozeman.
Thank you, Mr. Chairman, and thank you, Dr. Hall, for being here. I know that you all do work awful hard, and our purpose is to help you get the job done. One of the things that, as you know better than anybody, you're kind of in the central position that we simply can't do things many times without you all weighing into it. one of the things that somebody ought to look at, yourself or GAO or whatever, would be how much not getting information, how much that adversely affects the ability of Congress to do its job. Again, that's a huge deal. The other thing that I do think is important is that, and I know that you don't, you have problems with resources and things like that, but we need to measure things. And you all weigh in on bunches of stuff. And many times that's accurate. Sometimes it's not as accurate. And sometimes it's not because of the fact that, there's a mistake to be made. It's just very difficult to do these things. I think it would be helpful for us to know the areas that we can truly rely on the information versus it's a guess. But you can only do that through metrics. You have to have the ability to check yourselves out. And I don't think that that's happening right now. Can you talk about that? And
Sure.
If you don't have the resources to do that, then, what would it take for us to give you that ability? Because I do think, regardless of what we do, you simply need to have that information. We need to have that information as we make really important decisions.
Well, I can say one of the things that we do every year, we call it an analysis of actuals, where we sit down and look at all the budget categories and see what happened during the year, and what we predicted during the year. How did we do? How far were we off? We actually sit down and go through that and have a meeting. How close are we? How far off? How are we going to adjust our view of this going forward? One of the things that we've been thinking about, it sounds like it may help with this, is we're going to maybe start publishing our analysis of actuals, so you can actually see exactly how we did
I
in
think
every one of these budget categories. The tricky part, of course, is sometimes the budget categories are larger than pieces of legislation, so it's hard to know about a small piece of legislation, but this will give you an idea of where we're being more accurate and less accurate.
Right. And I think at times, too, we run into disagreements. There's areas where I think the committee staff, truly our experts in particular areas, have significant disagreements, and I would hope that that there is dialogue to try and work out the differences and at times maybe change your perspective as to what's going on.
Yeah, well, one of the things that we now do, we've always sort of done it, but we're now sure to do, is when we get pieces of legislation and a committee has some data that they've looked at, has some analysis that they've looked at, we ask for that, and we be sure we look at that. We always go further to do an independent look.
Sure.
But we want to be sure that a committee feels like we've given them a fair look at what they've looked at. I think that's an important starting point for us to be sure that we're unbiased and objective in what we do.
No, I very much agree. One of the things I think you talked about when you were here last time, you talked about the problems of retaining qualified people. And then also, I think you said in your testimony that over the past 3 years, back then, more than 60% of those to whom CBO had made offers had chosen to stay in academic positions. So that, it sounds like that's a huge problem. Acknowledging, the funding constraints that we're under and things like that. What do we do to help you get the people that you need and retain people?
Well, one of the things
be a more competitive employer.
Sure. Actually, one of the things that has changed is we had been capped so that all our salaries had to be basically below a member's salary, below my salary. While a lot of the people we're competing for are senior managers in the executive branch, they have a higher pay scale. They can make as much as $30,000 more than I make or anybody at CBO. We've now got to change, so we're allowed now, going forward, we're going to be allowed to start paying our senior managers on as much as the executive scale. Not that we're going to do it, but I think that'll make us more
competitive. But you've got that flexibility.
We now have that flexibility. I think that's going to be an important thing for retaining our top people. Mm-hmm. So that actually was a really good move. We're trying to be careful in how we use it. But
so retaining and then also recruiting?
That's right.
Okay,
that's right.
Very good. Well, thank you, Mr. Chairman.
Thank you. I appreciate all the input from members today. I've got a lot of notes. There are a lot of things that we, as well as CBO need to do to improve the process. One thing, though, that kind of is, you had it in your opening comments, and it kind of stuck with me, and I think that's been echoed a little bit here, but not directly. And that, have you considered serving as kind of the aggregator, collecting estimates from a number of outside think tanks and things, and reporting that as part of the transparency, as well as the answer that you come up with? Is that a potential solution?
I'm not sure it is. We're happy to do what we're asked to do, but one of the things you get with CBO is you get consistent quality. We do high quality work, and we work very hard to be unbiased. And this is one of the issues, for example, when we make models available. Part of the advantage of CBO is not just that we have these models, but we're the ones who run the models. If we want to get input from think tanks and et cetera, I think that's a good idea, and I think we do, in fact, go and talk to think tanks and get their views on things, get their feedback on how we do things. We're happy to try to do that more and see if that helps. As to whether think tanks will spend a lot of time producing competing estimates on so many of the small things we do, that's probably not realistic. But I do think that there's value in having us assure you, at least, that we go and talk to think tanks and spend some time getting their views on things.
Okay, I appreciate that. I learned a lot today. I think there was kind of general agreement that we have a broken budget process. I've watched this for years now and chaired it for a while, and I know that most of the budgets never last more than 40 days before there's a waiver of the budget, and as Senator Whitehouse pointed out, it only takes 60 votes to overcome it, which is usually the same amount that it takes to pass the legislation, so it's virtually 100% assured. And one of the things we had from our hearings, the 13 hearings that we did while Senator Whitehouse was the acting ranking member, was that there ought to be a higher threshold for higher numbers. And I think we should consider that if we're going to have any possibility of this making a difference. I will continue to hold some hearings, and we'll go back and review the material from those hearings that we had. From today, some of the other things that I did hear that this is the most partisan committee, and I want people to know that it's been the most partisan committee since 1974 when it was first initiated, and the process has been for the majority party to hold opening statements so that the other side can comment on the budget and then let them see the budget. And I never considered that to be fair, so we've changed that process. They now get it 5 days in advance, and I think it helped to expedite the markup and the hearing. Of course, in exchange for getting it 5 days early, everybody has to turn in their amendments. And one of the things I learned working with Senator Kennedy when I chaired the Health, Education, Labor, and Pensions Committee was that when those amendments come in early, there's a seed of possibility in every one of those amendments. And sometimes you got to let them grow, and more often what you need to do is look at the same seed being planted by both sides of the aisle and see if the people can't get together and come up with the common one that'll work. And that's what I'm hoping will come out of this budget process and make it less partisan. When it doesn't exist, when the results don't exist more than 40 days, then reconciliation becomes the most important part. And reconciliation has its shortcomings too, because every amendment has to have a budgetary impact of some significance. And so the rules that follow that make actual legislation very difficult. But if that's the only way to move forward, then that becomes the method of choice. And both sides have used it. I think there are better ways to legislate, and hope that we can get to that. Now, on the things that we did today, I think one of the key messages was also that assumptions matter. And, you know, when we talk about transparency, there aren't many people that are going to follow a model, you know, with all the different arrows and things that would be involved in that. which are even tougher to explain verbally. But assumptions, I think that they do have a pretty good ability to understand, and if they know what assumptions go into it, that might make the kind of transparency that we're talking about for particularly non-economists, which I would assume is almost everybody on the committee and almost everybody in the U.S. Senate. I also like the idea that everything should be written in non-Swahili. And we should have some better titles for our bills that aren't quite as biased as what they might be, but tend to get people to not be able to vote against them based on how good they sound, whether the text that follows does that or not. And I appreciated your comment about allowing people to be able to sit down with the analyst and get a little better understanding of where the information came from. I think that, particularly for people that have been an analyst, that would be very helpful. So thank you for being here today and for your comments, and we'll continue to work with you, and I'll be trying to engage the committee in doing more oversight work in particular areas that we can, not that we would legislate in, but that we would pass the information on to the committee's jurisdiction. So thank you, and with that, this hearing is concluded. Oh, people can turn in lists of questions if they wish, and we'll send those over, and I'm sure we'll get a response. Great. Thank you.
Thank you.